guys, it's me, that brown nurse. I'm a pediatric student nurse in my final year. I'm going to be discussing a day in my life as a student nurse and what I'm doing at the moment in my career. I'm on placement in neonatal intensive care unit in a hospital, looking after babies and their moms and their family. And I'm going to tell you what happens throughout my day when I start my shift till the end of my shift, and how I manage my own patient workload, and how you can do yours once you're in like near end of second year or middle of second year, or if you're on your final year placement too and you need some more tips. And if you do have any tips for me, please drop them down below too. It would be super helpful. So let's get started. This is a day of my life. I get ready, I wake up. Well, I wake up and I get ready. So two things are twisted. I wake up, I get ready, and then I go in the car. My dad drops me off to work with my mom as well. So reach placement, and I'm like 2-3 minutes early sometimes, or 5 minutes early. I'll walk in and the handover will start for the patient. So the sister or the nurse in charge who is in charge overnight will hand over what's been happening throughout the night with the patients, and any like updates, key updates and stuff, and what needs to happen during the day. So that will happen, and the charge nurse will remind the nurses of like the audits they need to do and stuff, and like any new equipment they've gotten. So then the patient load comes in now. So we go to the nurse who is supposed to hand over the patients to us, and then she will give us down a handover of the patients I'm meant to be looking after and my nurse. Obviously, we have to be supervised in terms of like checking safety check equipment and stuff. So making sure the nurse actually checks that as well. Oxygen suction, all that stuff. So we get handover for the patient, a brief summary or a big summary if it's a new patient. Because sometimes if it's the same patient you've looked after prior to, like yesterday, you do have a rough idea of like the main parts, but you'll get an update of what's happened, and you can check the notes on the system anyways, what's happened throughout the night, what the doctors have planned anything to do in the daytime. That happens, then we start to do the safety checks. All that stuff happens with the nurse as well. Be working with nurses and checking that. And I'm just gonna be honest right now. I actually see the job list and make a job list as well. So for example, currently what I'm doing is if the baby is due a feed at like 9 p.m, I start my night shift at 8 p.m. Making sure like checking the notes first, and activating myself onto the patients with the nurse as my supervisor, and then like on the system, on the hospital system, and then I'm gonna see if the baby is due cares and needs observations. So, and that's like checking temperature, heart rate, capillary refill, respiratory rate, and their cap refill, I said, yeah, all the basically observation checks, and the blood pressure as well if it's due. They normally do blood pressure like 12 hourly, once a day for a baby sometimes, or twice or more if it's on like severe medication, or if it's got a certain brain condition or any types of like severe conditions. And so we do that. So I spend like literally 10 minutes doing nappy, because these 2026 babies are something else. They are fighting and like kicking and everything, and you're like, I'm trying to do the nappy, like I'm trying to do the nappy, just can you just put the legs, like they will not relax. And it's quite cute actually, that like they're kind of angry and feisty, like they want to get this done over with ASAP. I'm like, okay, and boom, job done. So we've done that now. We've done the like cares clean. We've also like fed the baby. Then you have to document everything that you've done and how the baby's been on your shift. What color is the baby? If it's like working hard in terms of breathing rate, saturations, you have to monitor. If it needs continuous monitoring, if it needs an like 12 lead ECG or whatever. So all this stuff needs to be documented, like I said. And then what happens is, maybe if you have two patients, you will check the job list for the second patient, and then make a schedule like you're doing one and then the other. Once you've done that, it'll be fine and you'll be good to go, as long as you document after each patient's thingies. Then, because sometimes I'm like, oh, I need to remember to document, then I document because I'm like, no, I've not documented. So they recommend about 2 to 3 times per shift you have to document what's going on with the baby, any changes, and if you weigh the baby as well on that shift, you need to document the weight of the new weight of the baby, because that'll be like calculated on the feeds post next shift or whatever. So then their feeds will be recalculated with the new weight, if that makes sense. Sorry, I'm yawning, but it is currently 1:05 a.m. in the morning, and I am trying to study at the same time, but I'm just making this video for you guys so you get to know how it feels to be me at the day in the life of a nursing student working in neonates. And honestly, it's the best thing ever. It's very, very packed and intense sometimes, and working with these nurses and working with these mothers and families, because what you have to remember is family integrated care is when you're allowing the family to actually care for the baby, integrating it. So you will be encouraging families to do skin to skin, holding the baby, having cuddles, even like doing cares and feeding the baby. Sorry, sorry about this, I'm yawning, I know, but yeah. So this is the main part of neonatal nursing. It's not just about the baby, it's also about the mom, and it's also about the dad as well. Because at the end of the day, that baby is gonna learn their smell and touch and their voice. So making sure you're getting the parents to speak to the baby, or even like me, when I'm trying to do cares now, I'm like trying to speak to the baby, and they actually settle down when they hear voice, because our voice is like vibrations to them, and we speak in a calming voice like I am doing right now. It's actually recommended that they like it. So keep doing it and they can grow. And make sure you're checking your feed. Is the feed correct? The mils per kilo, or like 120 mils per kilo per day, or 150 or whatever. All that needs to be checked as well. And if there's any like medication due in the drug chart, you check that. And to be honest, the nurse actually hands over about medications due, but you will check the drug chart and everything if that's been signed, and you will make sure it's been signed, or signed by the prescriber, signed by the senior nurse, or signed by the nurse looking after the baby. And to be honest, the nurses will do the meds, but like then again, you can help assist with the meds, because that's how you practice your meds management skills, and your 5 R's, like right patient, right time, right documentation, right route, and right dose. I think I got that correct. And I feel like not many nursing students know something. Like, working in neonates and working in peds is a big difference. It's not a major difference, but there's a big difference. You will have to get used to the quietness and the lighting, like the minimal lighting, because sometimes you feel like so sleepy, but all this quietness and the room and the noise level